From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Laura Hutchinson. The opioid crisis in Massachusetts and across the nation continues to rise. It's become a health crisis in our area, which is where 22 News in Focus comes in today. We'll spend the next hour talking about what the state is doing to help those suffering with addiction. We'll also talk about resources that are available in our area if you know someone who needs help. And we'll hear from someone who has struggled with addiction so we can find out what it takes to get better. Joining us first today, we have Dr. Robert Roos, an addiction specialist with the Sisters of Providence Health Systems and also a member of the Governor's Opioid Addiction Working Group. Thank you so much for being here.
Thank you again, Laura.
You know, we're going to have an opportunity this program to hear about resources locally, to hear from someone who lives locally who has gone through this themselves. I first want to start off with what you're seeing locally. Who is this most affecting, and how are people starting down this path?
So, as the treatment provider for many different treatment programs in the area, including large opioid treatment programs, what we see in Western Massachusetts is what we've seen and has been reflected in the data across the country. That individuals who are presenting for addiction to opiates, which now is most commonly heroin use, first started with prescription opiate dependence. This has truly become an addiction that has had a predisposing factor of exposure to opiates. Now, most individuals who first are exposed to opiates were exposed through exposure from a family or friend that may have been prescribed from another medical provider. When we look at that data across the country, that's certainly what's been reflected there, and that's what we're seeing every day here in Western Massachusetts.
And now I know that you were on the governor's workforce for this, and I know one of you recommended about 65 different recommendations or so, and one of those had to do with raising awareness. Do you think that families understand that this can happen anywhere in communities that are not just the cities, but in small town Western Massachusetts?
We are certainly seeing, I think, an increase in the recognition that this is a problem that can impact everyone. From 2000 to 2013, the rate of heroin overdose death nearly quadrupled. And some of the areas in which we've seen that rise most dramatically was in areas that it typically wasn't affecting, particularly in areas that were not as urban, so in more rural and smaller towns, amongst women, and amongst individuals of all economic classes. And so over the last 15 years, we've seen that reflected in the data, and I think our communities are having increasing recognition that that is something that impacts everyone, regardless of where they live or the communities in which they work or their families are.
And why are these numbers going up so much? Is it because of how inexpensive it is? Is it because it's easy to get nowadays? Why is this happening so much now?
Well, the vast majority of individuals who have a heroin dependence or addiction now did first start with prescription opiates, which that increase in the availability of prescription opiates directly led to individuals developing that problem and then looking for other ways to manage it. We do know now that heroin has been more available, more potent actually, and less expensive, particularly than prescription opiates. And so that has only led to an increase in the problem over the last many years.
Okay. Of these 65 recommendations that you gave the governor's administration, what can happen now, or what is happening now?
So there are many things that are happening now, and that's really the exciting part about this. I think for the first time, and really the only positive thing that comes from a crisis like this, is sort of broad spectrum action to recognize this as a true public health problem. While the addiction may have criminal elements or consequences for some individuals, this has by and large and always been a public health concern, and public health approaches to deal with it are going to be most effective. And so what is happening now are certainly many things that are touching on how do we prevent the exposure to opiates and addiction in the first place, how do we intervene when those problems are being identified, and how do we treat individuals who have developed a problem and support individuals in long-term recovery. Mm-hmm. Some of the ways that that's happening now is increasing education, not only to individuals, but to their families and to the public. There are many educational campaigns that are ongoing, and part of the recommendations also included mandatory education, for example, for youth looking to start sports. Because in case they suffer an injury, that's often the first time somebody might be exposed to a prescription opiates. looking at how we intervene when individuals develop or might be developing a problem. One of the recommendations recommended that we need to increase the places in our healthcare system where individuals are receiving screening for problems, offer interventions and referrals for treatment. Part of that intervention also is making sure that providers have access to information that can help them guide them towards appropriate prescription opiate prescribing, and increasing the use and functionality of the statewide prescription monitoring program. Thirdly, when somebody does develop a problem, increasing access to effective treatment is going to be the most successful thing that we can provide individuals with a substance use disorder, and supporting them over the long term.
Now, we've done a number of stories on this topic, and many families have said, you know, when he was ready to go for a bed, there wasn't a treatment bed available. And I think that we all know how difficult it must be to get to that point where you are ready to get help and then to not have a bed available. Are we expanding our immediate resources so that somebody doesn't have the opportunity to change their mind about getting help?
So I think one of the fundamental tenets of successful addiction treatment is finding people treatment at the level they need at the time in which they need it. And so when somebody's ready and motivated to accept help, we need to be able to match that with a system that can provide it at that moment. If an inpatient stay, a bed, whether it's for acute detoxification or for a longer-term residential treatment, is what's needed for that individual, then we as a system and as a society should recognize that that's what we need to provide at that time. Fortunately, there is action on this front, both at the local level and the statewide level, to increase access in terms of increasing the number of beds, both for the acute treatment, but also for some of the step-down services, but also rethinking about how we view this disease. That not everybody who's struggling with addiction needs to go to the highest level of care at the first point they access treatment. Not everyone needs a detoxification bed, but many individuals do. But if we increase how we can access, patients can access treatment to all the other levels of care, then we can open up the system for more individuals who are looking and ready for help.
And what are some of these more long-term changes, things that can't happen immediately but might take a couple of years? What are some of these changes that we'll be seeing over the next year or a couple of years?
Well, certainly expanding that treatment system, the way in which we've designed it and the way in which it supports individuals over long-term recovery is not something that can be fixed or changed overnight. But to get support now throughout the Commonwealth and from the federal government when needed to support how we redesign healthcare systems, how the insurance companies are able to support and pay for treatment, and how do we develop a system that identifies problems early, connects people to care, and surrounds them with community supports, be that employment, be that peer support, be that other programs over the long term, is how as a community we can really take control and reshape how we address this public health crisis.
Now, I know that the state has a prescription monitoring program. I was interested to look at some of the numbers and see that statistically the numbers are very high in Hampden County for people who are at risk, so to speak, people who might be receiving prescriptions from more than one pharmacy. Is the state making changes to see, at least, be proactive about when they see those numbers to act on that? How do you sort of approach some of these people and see if there is an actual problem there?
Right. One of the things when you look at the prescription monitoring program data, you will see immediately that there are a large number of opiates that are prescribed to individuals in the Commonwealth of Massachusetts. More than 171 million opiate tablets were dispensed in one calendar year.
Wow.
That's enough medication for every individual in the Commonwealth to have more than 200 pills.
Right.
When we look at individuals that may have activities of concern, the prescription monitoring program in the Department of Health is looking at individuals who may have received more than 4 prescriptions and more than 4 pharmacies from 4 different providers over the course of that calendar year. While we can't say for sure what causes one to do that, it does raise a little bit of alarm for the provider to have a conversation with that patient that they may be developing a problem and that their care would be better served in a coordinated fashion. And so the prescription monitoring program improvements that are going to be underway and are already stated as a priority are going to involve the improvement of having providers be able to access tools that can help guide people with problems into the appropriate treatment. We already have a system that identifies the prescriptions and uploads it for all providers to use. It already is mandatory for providers to check the system before they issue a controlled substance prescription, with certain exceptions. But there is legislation that would be needed and is filed that could actually increase decrease the amount of time that pharmacists are able to take to upload that prescription from 7 days to 24 hours, which would thereby increase the availability of that information for providers in a more real-time fashion.
For people in Western Mass, what is step one if you're in a problem or a loved one's in a problem and you need help? What would step one be?
Yeah, step one would be to reach out and ask for an assessment for treatment. There are many ways that one can do that. There are multiple treatment providers in the area, and the state Commonwealth of Massachusetts Department of Public Health operates a substance abuse helpline. So if you're looking for services, call the 1-800 number helpline that can give you access to treatment availability in your area or access to an assessment for a level of care.
Okay, very good. And I know that there are a number of resources available for support. Once you've gone through some of these treatment programs, we'll be able to talk to some of those people here today. Dr. Roos, thank you so much, as always, for talking to us. It's good to see some changes happening in the state, and we'll, of course, touch base with you once again once we see some of these put into play. Thank you so much.
Thank you very much.
Appreciate it. And next, we'll hear what it's like to struggle with addiction and how one man turned his life around. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about drug addiction, treatment, and long-term recovery programs. In a little bit, we'll hear about what resources are available for people struggling with addiction. But first, we have someone here today who wants to share his story with hopes that it will help someone at home. Here to talk about his journey from addiction to recovery is Michael Butcher. Thank you so much for being here. I appreciate it.
Yeah, thanks for having me.
Michael, you're from Hamden. You're in Western Mass, and some people living in Hamden might not think that drugs are an issue in their community, and you're here to say that that's where you were when you started down this path. Share your story with us.
Sure. So I grew up, like I said, in Hamden, and you know, it was a fantastic town. I grew up as a fairly normal kid. Loved sports, loved video games, loved hanging out with my friends. You know, the one thing that I always wanted, though, was to be a part of that in crowd that everybody knows about, you know, in school growing up. And, you know, there were a lot of kids that I always looked up to. You know, when I was in high school, you know, the really cool thing to do was to go out and have parties. You know, those parties typically involved alcohol, marijuana, not some of what we called at the time the harder drugs, but that was how it started for me, you know. I can remember just seeing those kids, you know, and seeing them go out and talk about all these parties they were having, and I wanted to be a part of that. You know, I wanted to be a part of all the fun they were having. And in order to be included in that group, that was one of the things that was assumed that you did. And, you know, it didn't happen right away for me, but eventually I was willing to do that just to be a part of that group. And it was fun. It really was. I'd be lying if I said it wasn't fun. We had a good time, but there came a time where, you know, the alcohol and the marijuana turned into prescription opiates, and that was something that it seemed like overnight even just became so popular amongst kids my age. And this was when I was 16, 17, 18 years old. Overnight it seemed like everybody was talking about it, how it was so awesome, it was the cool thing to do, it was the best thing ever. And I didn't pay too much mind to it at first, but I remember hanging out with a friend of mine that I looked up to that was part of that in crowd, and he pulled out a bottle of OxyContin, and he was like, "Hey, have you ever tried this before?" And I was like, no, I hadn't, but obviously I've heard about it, but I thought we were just going to drink. And he was like, no, this is fun, let's do this instead. And he gave me a pill, and without really thinking too much about it, I took it. You know, he was a good kid. I didn't think he would lead me down the wrong path or anything like that, and it was a blast. I had a great time. I didn't wake up feeling horrible the next morning or anything. It was fun. And I thought to myself, well, that was awesome. Why hasn't anybody told me about that sooner? Let's do it again. And that's exactly what I did. I did it again the next day, and it was great again. And you know, I had no clue that little pill was going to turn into a life of misery. You know, when I got out of high school, I really didn't have much in terms of plans. I wasn't going to college. I was working full time. Just more time to hang out with my friends, and party was what we did as much as we could. You know, it turned into doing these pills was an everyday thing. as often as we could, because it was the only thing we had that was fun, you know. And then all of a sudden I remember waking up one morning and not feeling so great, you know, feeling almost like I had the flu. I just achy and everything, and I called up one of my friends. I was like, hey, do you feel like that too? And he was like, oh yeah, I did, just take one of the pills though, you'll be fine. And I took the pill, I felt great. And you know, that was the first time I actually remember having any sort of withdrawal symptoms. I didn't know what they were at the time, but that's exactly what they were. And then I proceeded to chase away those withdrawal symptoms on an almost daily basis by taking those pills. And the pills are not cheap, you know. They weren't necessarily easy to get all the time. Sometimes they were expensive, a lot more expensive than just having a drink or you know, going out hanging out with friends. I was spending a lot of money. But I couldn't stop because the feelings that I felt when I woke up in the morning were awful. I felt like I was going to die. It was terrible, and I had no clue what it was. All I knew was this was the only way that I knew how to live anymore. So it got to the point where it was literally taking up 100% of my time and attention. It was the only thing I thought about, morning in, night out, only thing that was on my mind. And I did whatever I had to do to get those pills. Eventually it meant stealing from my friends and my family. Things that I never thought I would do, things that I was not raised to do. But at the time it didn't seem like that bad an idea because I was so focused on getting those pills, whatever it took. That was the only thing I could think about. The thought of it being a bad idea didn't even cross my mind. That's how powerful they are. And that went on for a few months before my friends and family started to notice. You know, they're not stupid. They could tell something was going on with me. Especially when they started to notice money and things missing from their houses. You know, I started to get kicked out of first my mother's house, then my friend's house, then another friend's house. I went through a period where I was hopping from friend's couch to friend's couch, and I would stay there for a couple weeks so they would notice their, you know, medicine cabinet was ransacked or their wallet was missing or something like that, and they would kick me out, and you know, I'd be on the street, call up another friend, and that became my life for a while. Eventually it got to the point where there was no one else left to call. I was miserable, absolutely miserable, but the only way I knew how to live and enjoy life at all was to go out and chase these pills. I remember a person that I met when I was walking around the streets of Springfield had introduced me to heroin, and you know, the word heroin has such a bad taste to it. You know, it's just sounds like that's how I become a drug addict, as I switch to heroin. But you know, he explained to me that it's the exact same thing. He's like, the feeling's the same, it's a lot cheaper. They're basically the same thing, why don't you try it? And it was a lot cheaper. And I was desperate enough to try it because I wanted to get rid of that feeling, and I did. And he was right, I felt fine afterwards. But doing that once a day turned into twice a day, 3 times a day. And turned into where all of a sudden I have a habit that's so strong, I'm spending hundreds of dollars every single day just to support it. And I don't even know where I'm getting all this money from. And any chance I can get to take or steal or anything, I'm doing. Got to the point where I had been incarcerated. I had been in multiple treatment centers, detoxes, but I didn't want to stop. I didn't know what to do. But it got to the point where I was homeless in Springfield, and I decided enough's enough, I have to do something. I can't imagine my life with or without drugs. And at that time, I started to become willing to do whatever it took. I didn't know what it took, but I knew I was willing to do whatever I had to because I felt like I was going to die. You know, I had 2 paths, either figure out a way to recover from this or die. And that's when I really started calling out for help. Fortunately, my family never left my side. You know, they had to distance themselves from me when I was in active addiction, but as soon as they knew that I was actually ready for help, they came and helped me. My mother helped me get into a treatment program. And this time I actually took suggestions. You know, this facility was run by someone that had been there himself, and he was able to share some of his stories with me and explain that, you know, I recovered from this, you can too, and here's how we did it. You know, he helped me out one day at a time, learn how to live again, learn how to be a normal human being, do the things that normal people do, get up in the morning, make breakfast, do the dishes, shower, go look for a job, the things that just seemed impossible when I was out there using. And slowly but surely I learned how to do those things again. You know, I had the love and support of a lot of people that actually genuinely cared about my well-being. And that was absolutely essential. Without that, I don't know if I would have made it. But I was fortunate to have that. And, you know, I've taken it one day at a time since then. And, one of the key parts to my recovery now is trying to go out and help other people that are in that same position, because I've been there and I get it. And it's awesome to be able to give back and actually give something, to these people that I took so much from.
How long have you been clean for now?
I've been clean for 11 months.
How good does that feel to wake up in the morning and know that do you feel in control of your life now?
I do, and it's a miracle, because I haven't felt that way since I was a kid, and even then I wasn't in control of my life. I don't think I've ever felt this way.
How long did it take you to finally feel in control? Now, you said you were sort of in and out of treatment programs. Were you not serious all of those times you went in? When was it? How long did it take for you to reach the entering the program that you were really going to be successful in?
What it took for me, I wanted to get sober. It wasn't that I, loved this lifestyle and I wanted to be homeless for the rest of my life. Obviously, that wasn't the case. Right. But not only did I not know how, I wasn't willing to go to any lengths. I didn't realize the sacrifice and the time and the pain I was going to have to go to actually face what's happened to me, what I've done, and what it's going to take in order for me to move on from this. I really had to realize once and for all that if I didn't put my all into this, I was probably going to die. And at that point, I was blessed with the willingness to actually go out and do whatever it took.
Wow. Michael, this takes so much courage for you to come on here and share your story, and I want to ask you more questions just about how you've gotten through treatment and what advice you would give to people. We'll take a short break and we'll continue after that, but I thank you so much for coming on and sharing your story.
I
know that this is difficult to do. Thank you so much. We're going to take a short break and then we'll continue our conversation with Michael after this. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. We're continuing our conversation now with Michael Butcher, who's sharing his story of recovery with us today, with hopes that someone at home feels inspired to get help themselves. Thank you again so much for sharing your story with us. That takes a lot of courage to come on and do that. So talk to us about what you're doing now. Where are you working, volunteering, speaking? I know that you're doing a lot to try to help others right now. Are you going back to school? What does your life look like right now?
Well, right now I have a daytime job, but I work at Michael's house. It's a sober house in Springfield. I'm a manager there. Mm-hmm. That's the house that I found my recovery in, that I was able to get sober in. So it's awesome to be able to be a part of that, to be able to give back a little bit and try to help other people who are in the position that I was in. I also try to go around to different halfway houses and recovery homes in the area and just kind of tell them, my story, exactly what happened and how I got sober and how I stay sober today, in hopes that they might hear something that they can relate to and maybe be able to go down the same path.
So what would you say, as we talk about this health crisis in our area, what would you say to those 16-year-olds who are in West Springfield and Hamden and Chicopee and every community in Western Mass who are at the parties like you described and sort of tempted by this trend among their friends? What would you say to some of those people? What do you wish somebody said to you?
I wish someone told me that it wasn't worth it. There are plenty of ways to have fun. I'm not going to deny it's not fun, but I wouldn't trade one day of fun, 1 week of fun, 1 year of fun for a life of misery. Mm-hmm. It's not worth it. There are plenty of other ways. It's okay to go have fun and party, but there draws a line there somewhere that you have to not cross, and that can be difficult to see sometimes. But that's something that people have to be aware of, especially younger kids, that this is real and it can happen to anyone.
And you could end up sleeping under the bridge in Springfield, as you were saying. You were homeless in Springfield as well. Mm-hmm. And how about those people who are going through treatment programs right now? I know that some people might feel like this isn't for me, this isn't something I could do. You even said that at one point you just didn't feel like you could put the time into it. What worked for you? What did it take mentally, physically? Which programs did you feel just really helped you out and gave you the support that you needed?
For me, it was getting to the point, what I call my bottom, understanding that, again, like I said previously, I can't do this anymore. Something has to give, something has to change. And when that time came and I reached out for help, I had to really be willing to do anything. And And what I mean by that is I had to be willing to take suggestions. I needed someone to basically discipline me on the outside, to teach me how to wake up on time, to do the things I needed to do, to not argue with people, because that's the kind of mentality I had sort of grown over the years. I had grown angry and bitter from all the pain and everything that I had caused and I had received as a result of this disease, you know. What I would recommend to people is to never give up. You know, it doesn't always happen the first time. Sometimes you have to struggle, but if you don't give up, it will happen. You just have to want it bad enough. You have to want it more than you want to go out and get high again. I know that urge is strong. I've been there. But you have to want to be sober more.
Now, Dr. Roos was on before you, and he was in that working group that went around the state looking for what the state needs to help people like yourself who went through this or are going through this. What do you think that the state, the country, what do you think that we need to help those people who need help and support those people who have gone through the help and need to continue staying on a sober path? What do you think is needed right now?
You know, I think number one, the communities need to be more aware and more involved of what's actually going on. You know, over the years, there's been a sense of denial about it, I feel, in certain communities that, you know, it's happening, but it's only happening in urban areas. It's not happening in our neighborhood. When the reality is it's happening everywhere. There is not one community that's not affected by this. And it would be awesome to see more people involved, whether it be fundraising for different houses and programs, whether it be getting involved in terms of just getting the word out there so kids know about it. But the communities definitely need to be involved, and as well, also I believe the providers need to raise more funding so that we can get more places open. You know, again, as Dr. Roos spoke on, there's a lot of people out there that want to get sober, that want help, and there's just not beds available, or the places that are available are understaffed and ill-equipped to handle, you know, as many patients as they're bringing in.
So you think that there needs to be just an expansion of services, raise more awareness. Where do you see yourself going? You know, you said that you sort of wanting to commit the rest of your life to helping others. Is this something that you see yourself doing long term?
Well, it is. You know, I've always had a dream growing up. Every kid kind of has an idea of what they want to be when they grow up. I've always wanted to be a doctor. That's been a dream of mine. My family's into medicine. I didn't really know what field particularly, but you know, after going through what I've gone through, I find the idea of addiction medicine is intriguing, and I think it could use a lot more people and a lot more ideas, so that's something I'm considering pursuing.
Sounds like it could use someone like you. And you also were incarcerated. One, you know, conversation that you hear is if people with this type of addiction should be incarcerated or, you know, sent right to a recovery or a hospital or a medical facility. How did you feel when you were incarcerated? Did you feel that that was something that you needed? Did that help you? Did that at least mentally bring you to say, like, hey, I need to change? What did that do for you?
Well, it was most certainly a wake-up call. I wouldn't say it was enough to convince me to change, and the atmosphere inside a place like a jail or a prison is not it's not conducive to recovery. You know, you can want to get sober in a place like that, but it takes a lot because the attitudes of everybody around you are usually very negative. So it's difficult. And yeah, I think something like a diversion program for drug offenders could be very useful if they use it properly. It's definitely something that I'd be interested to watch unfold. Okay.
Well, we are also proud of you. Thank you so much for coming on and sharing your story. I'm so happy to hear you doing so well every single day. You're waking up stronger, it sounds like, and just continue on this path. It's so great to talk to you. Thank you so much for coming on. I appreciate it.
Thanks for having me.
And next, we'll talk about steps that you can take now if you are struggling or if you know someone who's struggling. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. At the start of the program, we got to hear what changes the state is making in response to the opioid crisis. We also just heard the inspiring story of a man who suffered with addiction himself and is now working to help others. Here now to talk about resources available for recovering addicts is Isabel Carvalho, co-founder of the Michael J. Dias Foundation and Michael's House, a residential program for alcoholic or drug-addicted men. Thank you so much for being here.
Thank you for having me.
Now, we just heard Michael's incredible story, who was just on. He's so inspiring, and I know that you know him.
Yes.
And you work with people like him all the time. Tell me how addiction has impacted your life. Tell me about these foundations. Share your story with us.
How addiction has impacted my life. It really started with my nephew taking his own life, and my own son being, you know, a heroin addict, which he is now in recovery, thank God. So when my nephew took his own life, you know, it was very painful. It was just a journey I just didn't think we could travel down in, and so we decided we'd have to turn it into something positive. So we started the foundation, me and my two sisters, with extremely wonderful, helpful people. We didn't really have a vision at the time, but we were just going to do something. We were going to change something. We were going to make a change. We were going to make a difference. So the foundation has grown. Out of the Michael J. Dias Foundation, we started the Michael's House, which, you know, is very dear to our heart. Again, you heard from Michael, very successful story. My son was also a guest at Michael's House, very successful story. And that's our inspiration every day, because we're not taking care of the problem, but we're making a difference, and that's all we want to do. We want to make a difference, because there's so many families out there struggling, suffering, and the pain is so great. The stories that I hear day in and day out, you know, the phone calls that I get, what am I going to do with my son? What am I going to do with my daughter? It's just so heartfelt, because I've been there, and, you know, for so many years I struggled with my own son and his journey, and, you know, still today I just, you know, live in the day, because, you know, nothing is guaranteed. But I want to help. I guess I want to make the journey easier for, you know, for a lot of people, because when I started in my own path, drug addiction wasn't talked about at all. Drugs were a very taboo subject, and no one wanted to go there. I live in a small town, and that's just, you know, not my son, not my daughter. That can't be. But it is, and it was my son. And, you know, my son was normal kid. He played hockey. He was on skates when he was 4 years old, and he played hockey. He made, you know, varsity freshman year, and he was good. He was going to go places. But it happened to him, and it also happened to me. And that's, I guess, why the foundation is to people to realize it's not a reflection on us. It just happens. Life happens. So let's accept it and go forward with it and deal with it and change it and make a difference. And that's what me and my sisters, that's what we try to do every day. It's a lot of work, but it's rewarding work. Because when we hear the success stories like Michael, like my son, you know, we feel good at the end of the day. We've done something. You know, and like I said, we're not trying to, you know, correct the problem altogether, because we can't do that.
How did your son start? What was his start?
Well, his start again was, I think because he was in varsity team freshman year, he had to keep up with the big boys, so he had to be the popular kid too. So he started with the marijuana, and then he went on to the prescription pills as well. And then it escalated to the heroin because it was cheap.
And what is Michael's House actually doing? Tell us about what's actually happening there.
Michael's House is an intensive, spiritually based program that uses the 12 steps. And you know, we do a lot of individual work, one-on-one. Our program director is very knowledgeable of the 12-step, what they call the Big Book, and he takes the individuals through the Big Book individually and in group sessions, and it's, you know, it's not working for all, but it's working for some, so we are making a difference.
What does it take for someone to come out of addiction? What type of commitment is that? What does it take to do that?
Okay, speaking from my son's story, and I actually heard from him that what it took for him was he was tired of chasing the drugs. That's when he decided that he needed recovery, because he was tired of chasing the drugs. And this was after being incarcerated for 3 months, after being in and out of numerous detoxes, live-in programs, boarding schools, you name it, but he was tired of chasing the drugs.
Now, how does the foundation and Michael's House operate? Are you working off donations? Do people pay for the services? How does that work?
Yes, there is a fee for Michael's House, but for those individuals that cannot pay or don't have the family support to pay for this fee, we do offer the Michael J. Dias Foundation through donations, offer scholarships. So the Michael J. Dias Foundation will honor the scholarships for Michael's House for the individuals that cannot afford to pay.
And for people who donate to the foundation, what are they donating to? What does it take to support the community? How many people would you have there at one time? Where are those? Why are those funds so necessary? I guess what does it take to support someone there? We can house 12 guests, actually 14 with managers. We have 2 live-in managers at all times. We have 24-hour supervision. We hired 2 program directors that we have on the payroll. So that takes a lot of funds, obviously, payroll, and then we have the regular operating expenses of the house. Now, the foundation, it's all volunteer, so none of us get paid. None of the volunteers get paid at all. So the only, like I said, the only 2 people that the foundation or Michael's House pays is the 2 program directors that we employ. Other than that, we have, but we have the day-to-day operations of the house, and that requires, substantial amounts of funds. And why is this program, when you started this, you must have felt that there was a need for this in the community. Why is this different, and why is this necessary?
Yes, the reason why was because me and my sisters, dealing with my son's problem, we visited various sober homes. Because my son was in different sober homes, and they were all, we found that, I don't want to leave my son here. This is not a good environment. It's just not he's already in a place in his life where he's not comfortable with himself, and putting him here. So we wanted to give him something more like home, a house that they would feel comfortable in, they would feel a part of. And I think that's what Michael's House offers. It's welcoming. It's a nice home. It's nicely done. It's nicely painted, and it looks beautiful. So when you walk in, you feel like, okay, I want to be a part of this.
Isabel, thank you so much for coming on and talking to us. We are thinking about your nephew. We're so sorry for your loss, but definitely sending our best wishes to your son in his recovery.
Thank you so much.
Thank you for coming on and talking to us. I really do appreciate it. And we will put a link to Michael's House and the foundation on our website as well.
Thank you.
At WWLP.com. Next, we'll discuss programs available for addicts who end up incarcerated. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the addiction crisis and resources for seeking treatment and long-term sobriety. Some addicts turn to crime to get the money to buy drugs, and they'll end up in jail. And for some, incarceration saves their lives. The Hampden County Sheriff's Department has a nationally recognized model for treatment and sobriety. And joining us now from the Hampden County Sheriff's Department, we have Della Blake and Peter Babineau. Thank you both so much for being here. I appreciate it. So when people end up incarcerated, and we had the opportunity of hearing from someone who talked about his story and how it unraveled and how he ultimately ended up behind bars. Does the buck just stop there? You know, what opportunities are there for people who find themselves incarcerated and not sure what to do if they want to get help?
Well, with the Hampden County Sheriff's Department, upon intake, and there's a classification process, our clients are referred to housing assignments. When they're referred to their housing assignments, they are met with by a counselor or case manager who at the time utilizes assessment tools that we use as a source of reference to determine what the risk factors are and what the needs assessments will be for those clients that are in our care and custody. At that time, based on length of stay, how long they are sentenced in our custody, they may be referred by the courts or by our classification to come to the Western Mass Corrections Addiction Center. Now, the Sheriff's Department has different departments from which our clients may be released from, so each area has their own substance abuse treatment program. From WMCAC, or the Western Mass Addiction Center, we have a 3-phase program. We have an orientation phase, and in that phase of our program, we introduce our clients to the culture of recovery. Courts recommend our clients, their classification recommend our clients there. Not all of our clients are open to being referred there. That's a determination that is made by us once they're in our care and custody. Then they're, once they meet with their case manager and counselor at WMCAC, they review the assessment tools to determine exactly what course of treatment that the client will take in their residency with us. And we have a 7-week cycle of substance abuse education. Their programming includes individual counseling, group therapy, special focus groups. 40% of our population have mental health issues, so we offer mental health support services. We have a high set program because a high number of our clients don't have their high school diplomas. Once you are a client within the Hampden County Sheriff's Department, working on your high set is a requirement while you're incarcerated with us. Then we have another phase of our program, phase 2, which is our work therapy and restitution program, and we use this opportunity for clients to get used to the world of work, put them back on the path of becoming responsible, productive citizens in their communities again. And the restitution aspect of our programming encourages our clients to kind of give back to the communities they've kind of taken from. A lot of our clients are very skilled, talented, gifted, and we take those gifts as opportunities to inspire them, motivate them, to reactivate those things about themselves that are good and positive as part of building the foundation and taking those talents back to their communities and giving back.
And how many people are we talking about? Of those incarcerated, I guess, what percentage would you say are suffering from some kind of drug addiction?
When you talk about people coming into incarcerated settings, it's important to realize that the majority of people who are incarcerated are not evil people. The vast majority are people who have been impaired by by substance use disorder. Right now we're looking nationally, and certainly within our own department, at about 86% of the people who are incarcerated have a history of substance abuse.
Wow.
So most of the people that are there are there because of their history of substance use. And if I can piggyback a little bit on what Della was saying, this is not a new problem. Substance use, substance abuse disorder, addiction is not a new problem. This is something that's been ongoing since time began. When Sheriff Ash came into office, he saw that simply warehousing people is not an effective way to deal with it. And he's been really aggressive over the years, over the 40 years he's been in office, to develop programs that would be effective. We're constantly in the mode of assessing what we're doing and how effective it is, looking at what the national trends are, looking at what best practices are, and trying to come up with ways to more effectively help people deal with the issues.
So how effective is it? What does your recidivism rate look like? How often are you seeing the person who was incarcerated last week coming in this week?
Not often. The recidivism rates are those are one of that's one of the catchphrases that people glean onto and really want, what is, but I don't think a lot of people understand when you talk about a recidivism rate, what you're talking about is merely those people who have been incarcerated and for whatever reason are again. And so that might mean a felon who sometime later has a traffic violation and winds up. So it's not necessarily that they're doing the same exact thing.
Sure.
When we look at recidivism rates, we look at periods of time that somebody is out and before they come back. So we look at 1 year out, we look at 3 years out, and when we look at national averages for 3 years out, what we're looking at is about 49.5% of the people who get out within 3 years are reincarcerated. When we look at our 1 year rate here in Western Massachusetts, what we're looking at is about 18.5%, and when we look at over 3 years, it's about 35%. Certainly lower than the national average. Certainly one of our aims is to continue to reduce that, and what we're seeing is on a regular basis that we are reducing that, and we're reducing the a lot of that is because at this point we try to release people from the lowest security possible.
And what do you think is needed to support the direction you're trying to go in? I mean, you're talking to these people, you must hear some kind of a disconnect through the program and the treatment, and when they leave, what is needed to continue them on the right path?
If you look at best practices industry-wide, there's two things that come up that all of the research indicates are the most effective aspects of treatment. Whatever that method of treatment is, whether it's cognitive behavioral therapy or anything else, there's two aspects that are most important, and that's length of time that somebody has in a program. How long is the space between last use and a subsequent use. So time, and the other one is relationship. What we find again and again through industry-wide as well as within the Sheriff's Department is when people are able to make those good, solid therapeutic relationships and keep those relationships ongoing, then they have the best opportunity for ongoing sobriety.
How much of this is related to budget cuts? We hear cuts all the time. How has that impacted you over the last few years? Has that diminished your resources? Have you been able to expand much? What does your situation look like financially?
I believe with the Hampden County Sheriff's Department, the sheriff has been very creative to make sure that success in reentry is one of our primary objectives. We are not exempt from budget cut experiences, but the services that support our population being successful for reentry, we've been able to maintain.
Perfect.
Our community partnerships are very important. The programming that we offer, we expect people to kind of take those tools with them and to apply them.
Della and Peter, thank you so much. It is so nice to hear that these programs are happening and that incarceration is not certainly the end. It doesn't stop there. Thank you so much. I really appreciate it. And we'll have the last word for you after the break. Stay with us. You're watching 22 News in Focus. Thanks to our guests for joining us. Thanks to you at home for watching. Have a wonderful Sunday. We'll see you next week.